Hi, I'm Dr. Phillip Chang. Today what we're going to be showing is another fat transfer procedure. This is a lady, she wants to be called a lady, who I've already done an upper eyelid surgery and a lower eyelid surgery on, and right now what we're going to do is show the fat transfer portion of it. We've taken the fat from her belly, and we've processed it, spun it down, taken out the blood components, and this is pretty much what you get. Okay, so you can see that this is a 1 cc syringe, and the fat is very yellow, and it's equivalent to what you might get with a lot of people getting Juvederm or other fillers today. The benefit of this is that we can transfer a lot more material. Juvederm usually comes in 1 cc syringes, and it does become pricey after a while. But with your own fat, what I usually tell my patients is that you have basically an unlimited supply. And so we take the fat, and what you'll see that we take about 20, we can take as much as we want, but in this case we've taken about 20 syringes worth. And so just think of yourself if you're doing 20 syringes of Juvederm. So the purpose today, if you can take a look at her, is again, you can see that we've already done her upper eyelids, and we've already done her lower eyelids, and where we're going to be putting the fat is giving her a little bit of a better cheekbone, a little bit of fullness in her lower face to reduce the appearance of jowling. And in the future, we're not going to be doing it today. We're going to do a laser resurfacing and photofacial to reduce some of these reds, some of these fine lines, and definitely some of these brown spots. Sorry.
Okay, that's fine.
So,
I need it.
okay. So her face is already numb, and again, this is what the syringe looks like. So I've already made these little incisions, and so we're going to be putting these syringes pretty much along her lower eyelid margin, and the purpose of that is to give decrease the appearance of that crease that you get from lack of volume there. She has a little less than usual because we've already done the eyelid surgery, but just to camouflage that margin a little bit better and to give her a little bit more cheekbone. Although again, she actually has very good, nice cheekbones. Can you bring that table a little bit closer? So with the fat transfer, again, we've taken this from her belly, but we can take it from pretty much anywhere. We're doing, you can do fat transfers to the breast, you can do fat transfers to the bottom. We call that a Brazilian butt lift. And so if you don't have enough definition in your bottom, we can do that. Typically what we'll do is take it from the hip and waist area, and that gives you a better definition on your hip and waist. And so you can see these syringes go relatively fast. That was already 2 syringes. And you'll see at the end of this procedure that she's going to look quite swollen, quite full. It will not stay that way, I can promise you, and I'll promise her. And what I usually will tell my patient is that you're going to look quite awful for a while, and you're going to hate me, and but then it'll settle down, and it'll look lovely. Okay, I'll take 3s now. So you can see these creases here. We're trying to reduce some of these creases, give her a better cheek arch, and a temple fullness. And if you look at any young magazines, this is an exercise that I do with my patients. I have them look at youngish models, somewhere in their 20s and 30s, and they all have this kind of S shape. So there's a fullness here, and it goes across here, and it comes down here. And so that's, to some extent, what we're trying to recreate without being too full, obviously. Okay, so you can see we're making this cheek really full. We want to make it, it's probably going to look about 3 times more full than it will wind up being. and it's going to look very, very overdone today. But then again, it's going to settle down over the next few weeks. And then we'll show you the before and after pictures to prove it. Okay. Okay, so that's how we do the cheek and the eyelid. We're going to turn off the camera and do the other side, and then I'll show you how we do the lower face in a little bit. Thank you. Okay, so what we've done so far is we've done her cheeks, we've brought it into the temples. We want to, I don't know if you can see it, but she's got a lot of vertical lines through here, and what we want to do is kind of make that a little bit more full, and a little bit more full here to hide this jowl area. So this is what we're going to be doing now. She has a little puncture here, and again, she's numb, and I think she's pretty comfortable.
I am.
Good, thank you. So, okay, so we've switched over to 3 cc syringes. And so if you think about the volume that a typical person gets, you know, with using typical filler like Juvederm, they're not getting anywhere near this volume. And I think we're probably close to maybe almost 30 cc's or 30 milliliters. So we're not trying to overdo this area. We just want to reduce some of those lines. Nothing hurting?
No.
Okay, good. So once we take the fat, it's actually a relatively easy process. And we do want to overdo it just a touch. And like I said, we want to put in maybe 3 times more than what will actually happen, because some of it will actually dissolve. And some of it is actually swelling. Okay, so we're going to do the other side now. Turn your face this way. Awesome. Okay, so again, you can see these vertical lines. We're going to try to reduce those. Part of doing that cheek is giving her a better cheekbone, but it also gives her a little bit of a lift in her cheek. And so some people would call this a non-surgical facelift, although traditionally we only call that, well, maybe not only, but we most often call it when we're doing fillers or artificial type fillers. Okay, so you can see some of those lines are dissipating. She's got a pretty scarred in line here. So you can see it's not lumpy. We're trying to reduce these lines, and you can see they're kind of dissolving as they become more full. One of the reasons why she gets them in the first place is because her face has become thin here. And so we're just trying to return the fullness that she's already had previously. Okay, we're almost done. Basically done. We'll do a little touch right up here into her temple again. Okay, last one and we're done. I think that temple looks good already. Okay, I think we'll put it here. Oops, where's that? We'll put it in this crease, and you can see this crease, when we add more fullness right above it, it actually raises her this frown line. So we'll do the same thing over here. We'll raise this downturn of her lip. And we haven't done anything on our lips, and again, in the future, what we're going to do is a laser resurfacing to reduce some of the skin issues. Okay, thank you.